right, back on our virtual show for the Bone Joint Institute here. Hartford Healthcare. Dr. Chris McCarthy joins us, orthopedic surgeon for hands and wrists. And we love talking to Dr. McCarthy because a lot of athletes break their wrists, hurt their wrists, break their hands, punch walls. So welcome to the show, Dr. McCarthy. Let me start by asking, what's the most common bone?
Yeah, thanks for having me.
What's the most common bone that you fracture in your hand, just even in daily work?
The metacarpals are pretty darn common. Punching stuff, like you just mentioned, get frustrated from that bad inning of pitching or whatever. Some of my friends from growing up did, but that's an all too common injury, even from simple falls or accidents as weekend warriors.
McCarthy, you went to Ohio State, right?
I did. The Ohio State University.
I pulled that out. Now let me ask you this: do you know why they play "Hang On, Sloopy"?
Gosh, you stumped me there. I don't know, but man, it is omnipresent.
All right, I didn't know this either. I just found it out. My ex-wife is from Salina, Ohio, and Rick Derringer is born in Salina, Ohio. He just passed away. Now, Rick Derringer, you probably know McCarthy from Rock and Roll, Hoochie Coo, Rock and Roll. But he also did Hang On, Sloopy. And I guess that's the reason that because Derringer is from Ohio and the band that did Hang On Sloopy, and that's why they play that stupid song and then fill in the gaps with O-H-I-O. So I'm teaching you something today? I didn't expect that.
Yeah, you're teaching me something, and also you're slightly offending me, which I think might have been the point. So, but yeah, I'm happy to be learning that.
The Buckeyes, man, I get under their skin. All right, McCarthy, let's talk some hands again, some sports. Cat and Contreras, Carl Anthony Towns and Willem Contreras, both playing their sports with broken hands. Or Cat really hasn't come out and said what's going on. There's something going on with his left hand. It's obviously bothering him, especially game 1, game 2, the games they lost and they should have won. And then Willem Contreras is a broken hand, and he's just told the whole staff, I'm not getting surgery. I'm playing the entire season as a catcher with a broken hand. What are the risks in that, and what kind of pain tolerance are these guys dealing with going through their seasons in this part of their careers with broken hands?
Yeah, there's a lot of intricacy in hand fractures that some don't need touched at all and just need some TLC while you heal through them. And so playing through them isn't that big of a deal medically, certainly, except for the pain that can happen from sort of impact from certainly catching as the catcher or trying to shoot or throw. And so some fractures, it's just you're not causing yourself any damage by just pushing through. And so certainly it's important to them to push through when they can. Other times it might cause the bone to heal sort of an angle or other things that then can get corrected later in an off season. That might just be a nuisance for now, and then later they can deal with it in the off season, sort of get it recorrected sometimes. That's not usually the ideal recommendation from those of us in hand surgery, but at times with professional athletes, certainly you have to be creative with how your treatment treat it.
I know feet have a bunch of bones. I know hands have a bunch of bones. How hard is it to, especially we see some of these old football players where their digits are going every which way. How hard, what's worse, a broken finger or a dislocated finger?
A lot of times broken fingers. Dislocated fingers many times are just going to be fine, and you can kind of suck it up and buddy strap it and push on through. Yeah, to your point, as a hand surgeon, it's hard for me not to look and notice athletes' hands on TV screen, like Booger McFarland's hands. He's got a number of injuries to his hands that I just can't keep my eyes off of.
Do you want to fix them?
I've never noticed this. This is awesome.
Oh, yeah. No, he's got some crooked
It's almost
fingers.
like a thing you can't unsee. So,
Who's the other one? Brian, is it Baldinger? The big dude from NFL. His just takes an absolute 90-degree turn. Can you fix that?
yeah, you can correct things like that. But if they don't have pain and they've just been functioning with day to day and it's not really, getting in their way, then we see all kinds of patients who show up who injured their fingers, even just home projects 6 or 7 years ago, and they've just been making it work. And so you don't bother with it. It's kind of surprising sometimes when it's not painful or doesn't get in the way, though, especially with those 90-degree angles. And NFL linemen, offensive and defensive linemen, man, they get it wrapped up in each other's pads and jerseys, and they can dislocate and fracture those fingers pretty easily.
I think my whole junior year, I did a buddy system with my pinky typed to my ring finger for playing receiver in college, Doc, and my pinkies are very crooked. But you're right. They do not feel like I don't care about them. I don't even notice until we have these conversations like, oh, yeah, I think I have a couple of those. That's right. Those are my pinkies. The one thing I've seen, too, in my travels of playing sports is these rugby folks that I used to roll around with in my early 20s. Dude, I wasn't ready for like rugby pain yet. Like I played college football and I thought, what do you guys got? I saw a dude like separate his finger or dislocate his finger and pop it back in place. Yeah. And I saw that like every week with these crazy individuals. These guys are animals, man. Like what about that? When you have a dislocated finger.
They are.
Is that not right? Like can you not do that? Or what's your recommendation?
No, you can. I mean, honestly, that a lot of dislocated fingers, you can just pop them back in place and they don't get unstable and fall out. And it just depends on what exactly tore later, collateral ligaments or what have you, if you need to sort of treat it surgically or not surgically later. But a lot of times, it's as simple as if you can suck up the pain, just popping it back into place. A buddy of mine from medical school, I'll give him a little shout out, Dr. Doug Olson, who's an orthopedic surgeon in Toledo. He played club rugby at Ohio State, and man, those humans are built a little differently up between the ears.
I was just going to say, it's crazy. It's not really a physical thing. It's more mental.
All right, it is Brian Baldinger. He got his knuckle and his finger caught in someone's shoulder pads. What about basketball players? You know what? I used to do this all the time. Get your hand caught on the rim or in the net. Yeah. What's one of the most traumatic hand injuries you've seen from an athlete that you had to repair?
Oh, yeah. This just not too long ago, college football player about a year and a half ago got his thumb caught in an ear hole of a helmet and dislocated his thumb and he was a receiver and he was just sort of like you've been just making it work. And but a year and a half into it, now he's out of football and he can't stand how unstable his thumb is. So we had to reconstruct all the ligaments of his thumb to get him back on track.
Are those screws and stuff you got to put in there? How'd you do it?
Put in suture anchors, kind of like what a little similar to what Drew Brees had done a few years ago, however long that's been, to restabilize the ligaments to get them to sock back in place. Use some suture anchors and some tendon grafts to build their ligaments back.
And I just know, like, even, you stub your finger or you got some kind of situation where it's not broken, like the rehab and getting your hands back and getting ready, like 100%, it feels like that's a little bit longer than a knee or a shoulder. Am I right about that? And what are some, like, hand exercise that you can do as an athlete that just beefs things up and keeps you from these kind of things?
Yeah, great point. My orthopedic sports surgeon colleagues who take care of shoulders are probably be upset I say this, but the hand therapy is a lot more complicated and can take quite a long journey to recover from. Yeah. We're really fortunate in our office to have some expert hand therapists that work day in and day out on this sort of thing. But stiff fingers are a real big challenge in our world, and there is no sort of clean-cut, easy answer for it other than the time and therapy it takes to mobilize things through. A lot of times, especially after injury, maintaining your arc of motion, so not a stress ball situation, but instead just truly getting all of your range of motion back is really the primary key. Stress balls, you think you're doing a good job of strengthening your muscles in your forearm, but there's a ball in your palm. So even if as you go to make a strong fist, your fingers are never getting their full motion into flexion. And so you're actually preventing yourself from regaining that motion. And the motion is the thing we as hand surgeons focus a ton on. The strength tends to come secondary pretty naturally.
Talking to Dr. Chris McCarthy. He is a hand and wrist surgeon from the Bone and Joint Institute and Hartford Healthcare. My uncle was a plastic surgeon that he was always trying to keep me from riding motorcycles and stuff like that. So he'd always show me these grisly injuries to hands and feet and stuff like that. Do you handle some of that stuff, especially motorcycle accidents or even work-related accidents? And how long can you sever a finger and then reattach it?
Yeah, I deal with that stuff day in and day out. Actually, right before I came on the call, we were handling something similar to that. My funny little snippet. I have two daughters, 6 and 4, Rowan and Lena, and they already know at a young age I can't stand motorcycles passing around because all they equate it to is that Dad's got to go in the hospital sometimes when they see a motorcycle injury. So, we deal with that quite often for better or for worse, and It takes a lot of people and multidisciplinary approach to fix those gruesome injuries up, because motorcycles are and can be pretty dangerous, but mostly not necessarily the drivers themselves of the motorcycle, but the other motorists on the road who don't see them or whatever.
Where are we right now with like bionics for hands? Like we talk to your friends all the time about hip replacements, shoulder replacements, and with this stuff, like people don't know. Like mess up one finger and then go through life, and then you'll realize how much you use that one finger. And when you can't use a hand or two, it's really debilitating to your whole life. Where are we on like bionic hands? I've seen like robot gloves recently. Like, how far in the future is this going, and where are we in the evolution of bionics for hands?
There are a lot of nicely complex and strong and facile orthotics and prosthetics for replacing one finger, multiple fingers, or the thumb, or even an entire hand. The challenge is that since we have 5 fingers, we can overcome a lot of deficit from 1 or even 2 or so finger amputations and make it work functionally, because our brains are really facile at relearning a new normal after all the recovery from surgeries or therapy, et cetera. So commonly, even though they exist in a really robust fashion, patients don't tend to use them long-term as much as lower extremity prosthetics because they start to learn a new normal and work around it more often. They also look pretty darn mechanical, the ones that are strong functionally, and so that can be an issue to overcome. And the real cosmetic, nice-looking ones tend not to be as functional, so you have a trade-off one way or another. But we deal with pretty often patients who amputate a finger or 2 or more, and to your question, Rob, that you can probably about sometimes 6 hours, sometimes as long as 12 hours you can put it back on. We like to do it sort of as soon as patients come up into the ER and through the door. But
does it have to be on ice?
Yeah, and
does it have
plastic?
to be kept cold?
Great questions.
Yeah, no. We always see this on movies.
You keep it cold in a bag and on ice, and not the ice touching the part, because you don't want to give it frostbite, but you want to keep it cold and refrigerated, essentially.
Whoa!
But yeah, patients sometimes come from a great distance, and we can put it back on, and they can work even after some delay.
Why hands, though? Why, when you were picking your specialty, you could have picked anything: hearts, brains, whatever. Why hands?
I like variety a ton. I get bored pretty easily. My joint replacement surgeons will get upset. The friends that I say this.
We talk to them all the time.
We joke in our world that they only do 2 operations, hip and knee replacement. But there's so much variety in my world. Really, truly, hundreds and hundreds of different types of surgeries we do, and issues we can treat. And I never get bored. I love that about what I do. And certainly, like we're talking about now, even though some quote unquote small injury can happen to 1 finger or 2 fingers, it's super impactful. We forget how much we all, as human beings in all walks of life around the world, use our hands the way we do, even to speak. So it's just really impactful for people, and I love that about what I do.
My mind is blown, because you're telling me that a finger, if I cut my finger off, I can still give that severed finger frostbite?
Stuff freaks Ben out.
That's crazy, dude. So that's a lesson, man. Y'all that cutting your fingers off, you want to put them back, don't put them in ice. Get them on ice, right? Like
keep them cold.
Yeah, you got it.
All right.
I'm glad I could teach you something after you taught me that.
Remember, that was Ben. Doc, that was Ben. That wasn't me.
These Buckeyes, man. I tell you.
He's from Indiana, so he is busting your chops.
They're always
so
on.
I played with with Jim Abbott. Who was born without fingers, but he did have like the solid part of his hand and could do things that I couldn't. I mean, he was unbelievable with that. Mm-hmm. As far as like birth defects and things like that, have we been able to kind of slow that? Or are we still seeing kids that are born without hands and arms and things like that?
Yeah, we still see it. A lot of it's stuff that either happened in utero that you couldn't plan for or didn't plan for it, or there's some congenital syndromes that cause that sort of thing. Sometimes sort of bad luck through the birth process. So there's still plenty of that happens, and it's unfortunate. But the nice silver lining, I guess, if there is one of those situations, just like Jim Abbott is a great example of that. But when you have an injury like that or an issue like that at a young age, the brains are so capable of living within their normal and creating function out of what their normal is. And it's just super remarkable what kids can overcome.
So are you guys all for the college football playoff expansion? Or you guys like it where it is because you won last year? Like, how are the Buckeyes looking at this next year college football?
I like the expansion. I like where we're going in the direction of college football playoff situation. I'm glad they're doing the reseeding thought process. I think that sort of a little bit the more the merrier in a bracket style system. And also I'm a little worried that at some point, we're not going to be on the top of the mountain forever. So maybe another little backdoor entry system might be nice for us to maintain relevancy in the playoffs.
Wow,
if we go through a little
realist.
slide,
A Buckeye that's a realist. Yeah, excellent.
All right.
Hey, things ebb and flow in life and in sports, so I'm trying to prepare myself.
So Al Leiter, and I played with a guy named Pat Pasillo, who was on the 84 Olympic team. They had a lot of skin issues with blisters and things like
I'm
that.
glad you're asking that.
And I know that our trainers, and I had a guy that was a Vietnam. What do you call the guys who help the people?
The medic.
The medic. He
Yeah,
was a
he's a
medic,
medic.
but he wasn't really a certified trainer. He was like, pickle juice. Stick your fingers in pickle juice.
Why you guys
Is there
won in
any
90?
kind of either remedies or things you can recommend? I still coach 16U pitchers, and all of my guys on my travel team can pitch. How do I get them to toughen up those blisters?
I mean, Aquaphor is honestly really good. I know it comes. I mean, having young kids, Aquaphor's in our house all the time, but it is that kind of ointment can be so good for those blistering issues.
Really?
So even as simple as Aquaphor that's laying around, yeah.
Not pickle juice.
I can't recommend for or against pickle juice. So maybe it's trial and error situation.
I love how you're finally giving these old housewife remedies.
Yeah,
to
I'm not
these
going to go there,
doctors.
but that's great.
My last one, just as far as what we can do, because you kind of skipped over this a little bit, like hand exercise for the kiddos. My biggest thing, especially being a receiver, like having
those guitar things
those
work?
little
Because I have one of
grippers.
those grippers.
Oh, I know what you're talking about. Yeah, with
they're
the guitar
individual
grippers.
fingers I used to do for my pitching hand.
What are some things that you recommend for kids to strengthen up their hands?
Yeah, I think that's right on. Those guitar stretchers, like getting the fine motor dexterity muscles moving with the rubber band sort of resistance is really, really helpful. And it's hard to do sort of at the gym in any other fashion. So doing that guitar rubber band sort of modalities to get the fine motor muscles in your hand as strong as they can, because those are not something we normally exercise. The forearm muscles that power us into a fist or power our fingers straight, those are easier because we sort of do that anyway with dumbbell exercises, et cetera. But I love that, just like what you're mentioning, that guitar type exercising.
Dr. McCarthy, man, you're fantastic. We appreciate it. And don't ever apologize for going to the Ohio State.
Yeah, we need to have you back on in the fall. Play
Talk some football.
Yeah,
definitely.
I would love that.
All right.
Excellent.
Anytime, guys.
Thank you,
I really
Chris.
appreciate it.
All right, man. Take care.
All right, bye.